And share my screen. Hello, everyone. Good morning again. Thank you for being here. My name is Diana Schulach. I'm the program manager at Family Focus Resource Center, and we are hosting in collaboration as part of our Super 14 organization through Captain. We are presenting this workshop on Autism Acceptance Month called Parenting Smarter, Not Harder. And we're going to talk about evidence-based tips that make a difference. Let me
Diana, can you
Yes, I'm going
turn
to
on
put it
slideshow?
right
Sorry.
now. Oops, slideshow. Ooh,
At the right-hand side at the top.
yeah, I just missed it. Sorry, there we go. There we go. So we are presenting today with the Super 14 captain team. And this is who makes up our captain team. It's the Santa Clarita Valley SELPA Family Focus Resource Center, North LA County Regional Center, and the Antelope Valley SELPA. So we are so happy to have everybody here today presenting. We're going to talk about today, we're going to first find out what is Captain? Who is this organization that we belong to? Who are we and how do we support individuals with autism? And then we're going to talk about what are the evidence-based practices for autism. I'm going to share with you this quick video so you can familiarize yourself with what Captain is.
So you've heard about and are interested in learning more about the California Autism Professional Training and Information Network, or CAPTAIN. CAPTAIN is a multi-agency network developed to support the understanding and use of evidence-based practices for individuals with autism across the state of California. It's made up of over 400 representatives from various agencies that support individuals with autism and their families, including regional centers, special education local plan areas, state and
I think the sound just went out.
has continued to increase in prevalence, with incidence currently at 1 in 36, according to the Centers for Disease Control. In our California public schools, there are almost 150,000 students who qualify for special education under the qualifying disability of autism. CAPTAIN was developed in order to respond to these increasing needs and improve programs and services for individuals with autism. The vision of CAPTAIN is to develop and maintain a training and technical assistance network focused on the use of evidence-based practices for autism that is inclusive of agencies that will work at the local level to collaboratively solve challenges and improve services for individuals with autism within their community. To achieve this, CAPTAIN's goals include increasing knowledge about autism and evidence-based practices through systematic dissemination of information, increasing implementation and fidelity of evidence-based practice use in schools and communities through high-quality training and coaching, and increasing interagency collaboration to make sure autism evidence-based practices are used equitably and positively. Our hope is that all individuals with autism can experience the most fulfilled lives and achieve their best outcomes by benefiting from high-quality, research-based services and practices. If you have any questions or would like to discuss CAPTAIN, please reach out via email at hs-captain@ucdavis.edu. or go to our website at www.captain.ca.gov. Thank you very much for your interest in CAPTAIN. So you've heard about and are interested in learning more about the California Autism. So you've heard about and are interested in learning more about the California.
Why is it not going to my next page?
Information Network.
Let me stop this video real quick. And there we go.
Great. So the autism diagnostic procedures does vary slightly across the three entities. So with medical, a comprehensive diagnostic evaluation and a DSM-5 is utilized to determine if there is a diagnosis, which will then lead to further treatment recommendations. It's typically conducted by a licensed physician or licensed clinical psychologist, and it's used in a private or medical setting. And medically based services can be recommended to target many areas of the support. So, for educational, to be eligible for special education services, the disability must negatively affect the child's education. The school services are then to provide access to the curriculum. A medical diagnosis of autism may not guarantee special education services. Educational eligibility for special education is determined by a team, which consists of school professionals and the family. The team then assesses if the student qualifies for special education services based on criteria that is set by the state and federal law. And if eligible, then an individual education plan, known as an IEP, is then developed. And so for regional center, we provide a comprehensive evaluation to determine if someone meets the state's eligibility standards for autism services. So this is done through a process that includes interviews, record review, observations, and the utilization of formal screening tools such as the ADOS-2. These are administered by a licensed psychologist. And then if eligible, an individual program plan known as an IPP is then developed as well, or an IFSP for our early start is developed to help the individual access and coordinate the services and supports that they need.
And for regional centers specifically, our roles and responsibilities specifically for the team that is part of Captain within the North LA County Regional Center is our behavioral services team within the clinical department. And our roles and responsibilities within that context is for our behavioral consultants to ensure that information about evidence-based practices is disseminated to a regional center staff, to providers, agencies providing services, to families themselves, and to the community at large. We also provide consultation to the case management team. So whoever your case coordinator is, if they need support to determine appropriate supports and services, we're there to provide consultation. In terms of we also make sure that all the services that are provided to our families and consumers are effective, and we want to make sure that they're meeting their goals. We also provide support to vendors specifically. We giving clinical feedback to the training team, and we schedule meetings to make sure that we troubleshoot and come up with the best solutions if there's any barriers to progress. We also are part of interdisciplinary and interagency collaboration to make sure that if there are any consumers that have autism, for example, but they also have, for example, a mental health condition, that we also take in consideration those pieces in order to provide the most appropriate recommendations for services. And we also help develop and provide training to regional center staff and the community.
And so these are some of the available services that utilize evidence-based practices. So services are always determined based off of the individual's needs. And this is not an exhaustive list, but these are some of the services that are commonly implemented for our early state and school age population. So that consists of applied behavior analysis, known as ABA, and that's either direct service or parent education. And typically the focus is on reducing challenging behaviors and skill acquisition. And then we also have adaptive skills training, which the focus is on increasing independence with self-care, daily tasks, and community integration. We also have social skills, which focuses on social interaction, typically in a group setting, and then AAC consultative services to help individuals with teaching functional communication utilizing AAC devices.
Family resource agencies. We are part of Captain because we provide families information to families on evidence-based practices, and we also share Captain's numerous resources to our families affected by autism. Please make sure you follow us on social media because we've created some very good reels based on Captain's philosophy on evidence-based practices. You could find one on springtime, getting your child outside during springtime, and we've got a really good one coming up that Monica just created on visual schedules, which is kind of a precursor to a workshop we have coming up next month. Family Focus also trains our family support providers and our community navigators with the AFIRM manual modules so they can share with the families that we serve. Our support groups, parents of adult consumers and the early year support group, are also learning from the CSESA resources for older individuals with autism and also the self-learning modules for toddlers. And we inform parents about advocacy, evidence-based practices, and other disability-related issues at our annual Parent Leadership Academy. You just missed it in January, but we will be having that again next year. And we also have a special community navigator programs serving the San Fernando Valley, Santa Clarita Valley, and the Antelope Valley. And we help families learn about evidence-based practices and generic services, specifically in underserved communities and cultures. So these are families who are not accessing services through regional center due to barriers. So if you know of someone, please have them contact us and we can help them with those applications.
Hey, so my name is Monica Gillis, and I'm here representing the schools. So as you know, and as you've heard in previous slides, we have 4 different agencies that are working together, actually 5 different agencies that are working together for this community to serve our families who have neurodiverse children and adults and babies. So we are all here working together. And so one of the things that I wanted to just share with you was the lens of schools. How do schools help the children within this community? And so we are 2 different agencies. So I'm representing the Antelope Valley SELPA, and we also have some team members here who are representing the Santa Clarita Valley SELPA. And so what our responsibilities are to make sure that there are instruction and supports that are specially designed to meet the unique needs of a child whose disability affects their educational performance or ability to learn in a general education classroom. So what we're really doing is we're looking at the lens of, we have these students who have been diagnosed with autism. What should we be using in the classroom to support their learning? How do we help our teachers and our instructors and our staff members guide and teach these students, and what works, right? And the other outcome or our other specific target is to provide the child an opportunity to learn in the least restrictive environment so they can ultimately thrive to the best of their ability when transition to adulthood. And one of the main goals of the schools is to, when we do have students who have specific needs, we always want to consider how much time they could spend with typical peers rather than pulling them out. So that least restrictive environment is really taking a look at how much time and to what capacity can the child learn with typical peers, with non-disabled peers. And then as the needs grow and as the levels of support grow, then we would add more support and maybe change that setting. And so we're going to take a look at settings in just a little bit, but let's go to the next slide. Okay, so the educational disability of autism. So we do have, in order to qualify for an IEP under the area of educational disability of autism, per our federal law, the definition is a developmental disability significantly affecting verbal and nonverbal communication and social interaction evident prior to the age of 3 that adversely affects the child's educational performance. And so there's other characteristics that are used in eligibility, and those might be engaging in repetitive activities and stereotype movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. And then the term doesn't apply if the child's educational performance is adversely affected primarily because the child has an emotional disability. And the educational performance does not only mean academic performance. Areas could include development, academic, behavioral, and social domains. So I think the really important message here is that the disability really has to affect how they access their education. Okay, next.
So based on what Monica's saying, we want to make sure that we're giving students the least restrictive environment so students can be as independent as possible. So there's a continuum here that we're able to offer evidence-based practices along the way. So we start all the way at general education, and this can include students with autism and students with all various disabilities within the inclusive environment. And this is with one general education teacher, perhaps even a resource consult teacher as well that can step in, even an instructional assistant that can step in with co-taught options.
Sorry,
Oh, that's okay.
that was the previous one, right?
No, the next one.
Oh, no,
Oh,
it was the previous there. You were on this one, correct?
one before that. Yep, you're good.
Thank you.
And we have co-taught options and push-in options in various districts. So this means there's a general education teacher and a special education teacher, also known as an education specialist. It's also labeled as general education for various needs with students. So they can still have general education minutes and service minutes, but they're able to get special education support from a teacher. And it's interesting because you're able to have general education students with that label receive support and evidence-based practices from an education specialist, to where it can be difficult to determine even who the general education teacher or the special education teacher is in the co-taught setting, and perhaps even push-in setting. So that's in general education for several districts now, which is very cool to see how evidence-based practices can still work in a least restrictive setting. And then we have the 504 plan, which is definitely separate from IEPs, and that's in the general education setting where students receive accommodations, like just close proximity to the teacher, various accommodations that are not IEP related. That would be 504. And then we go down the continuum to a more restrictive setting, to where students receive something called an IEP, or an individual education plan. And this is on the next slide. We'll talk more about this, but this is where there's a team that actually decides when a student is able to have an IEP. And this is where special education services are decided. And then we can kind of go further down to the continuum to if they can be included in a co-taught setting, to where we are least restrictive in that environment, or if they need special day support, to where they have more of a special day class regarding resource support, and where they're receiving academic. It could be even with an instructional assistant in a special day class as well, to where they're surrounded by peers that are also labeled special education, to where in a co-taught setting, it's a mix of general ed and special education, if that makes sense. And then we go down the continuum all the way to perhaps various needs where they're working on, instead of academics, it could be academics mixed in with living skills. So this could be for our students in requiring functional academics, all the way down to more of a home study where they need perhaps like a non-public school as well. So we can kind of go on and on about these different levels, but we are trying to go for the least restrictive setting based on what the students' needs are. So once you're eligible for special education, this is where the IEP team can really see what the goals are for the student and then apply evidence-based practices from there. So we can state the supports and services that the school district will provide for the student. And I know every district is a little different in the way they do this, but the SELPA captain teams work with staff to ensure that our students with autism are receiving instruction and support that are truly evidence-based.
So, how do we know what is effective intervention? So, at the beginning, we were talking about evidence-based practices. We had Regional Center talk a little bit about what are some evidence-based practices that might be utilized within home-based services. And as I mentioned too, we are hoping, one of our missions is to make sure that our staff within the schools are knowledgeable of what effective interventions are when it comes to teaching students on the autism spectrum. And so one thing that we have, and which is something we briefly learned about in the video, is this National Clearinghouse on Autism Evidence and Practice. And so it is a nationally based website. It's supported through University of North Carolina in Chapel Hill. They support this extensive research platform where they are gathering evidence from all over the United States on what is an evidence-based practice, what should we be using to guide our students, what should we be using to instruct the children within our community that have been diagnosed with autism. And so this is a really big website that I encourage you all to take a look at. It has information on the different science and the different practices. And then it has all the 28 evidence-based practices listed within the report. And then there's also this really great free website called Affirm, and it's Autism Focused Intervention Resources and Modules. And it's a free website that has modules on all 28 evidence-based practices. And you have to create an account. And each one of the modules is about between an hour and 2 hours long. And it really guides you in what these evidence-based practices are and how you would implement them in either the home setting, school setting, community. These modules are open to anyone that wants to learn. And so these are the different 28 evidence-based practices. And now, from my understanding is a new report will be released in 2026 with even more evidence-based practices. So there'll be another shift. So as research evolves, as we have the different institutions and all those people finishing their PhDs, researching different evidence-based practices, that list grows and it changes. So these are currently what the 28 evidence-based practices are. So these are the different practices that have research that support how we can teach our students and adults and children with autism. And you may already be familiar with some of these, but again, I encourage you to take a look at that Affirm website, and you have to create an account and you have access to all these different modules to learn more about what they look like and other resources that would support their implementation. Okay, next.
All right. Hello, everyone. My name is Malika Numan, and I'm also a program specialist for the Santa Clarita Valley SELPA, as well as a cadre member. And this is just kind of a glimpse of what Monica was speaking about. When you would actually go to the Affirm website, you will see modules where they have, for example, Introduction to Autism. You would select that module and then be able to go through the 2 to 3 hour training that she just eloquently described to you. What I'd like to do on our next slide here is just kind of give you, bring it into perspective, right? So as family members, as parents, you may be wondering to yourself, how do I take this knowledge you guys are telling me about evidence-based practices and actually make it something I can implement right away? And so we kind of created this chart here where, for example, perhaps at home, you may have a child who is dealing with little sleep. Maybe they're waking up in the middle of the night or they're not sleeping consistently through the night, right? And we know that this can be concerning for our children because when they're not sleeping, we're going to see more behaviors, and they're probably going to be behaviors that we don't prefer, right? And we understand that this is important to pay attention to because when our students are having behaviors or our children are having behaviors, they have impulse control issues. Perhaps they're not paying attention. Perhaps there's some issues around self-regulation. And so those evidence-based practices that Monica spoke about, as well as Ashley, become very meaningful because when you go through those trainings, you'll get more information about, for example, visual supports and how potentially you can create your own bedroom routine or chart to support your child with going through the night and sleeping continually. Or maybe perhaps you can learn more about an evidence-based practice that talks about relaxation strategies and learn for yourself what would be appropriate relaxation strategies to engage with your child as you're helping them get back to sleep or perhaps before sleeping. Another example would be screen struggles. We know students love to be on, the iPads and the phones, right? And when they're on those, they don't like to get off. So there are evidence-based practices such as reinforcement. How do you create positive reinforcement that can help students and your children at home be able to kind of wean themselves out in a more appropriate way, right? Versus throwing a tantrum and give you back that device when it's time for homework or time for bath or time for dinner. And there's others like task analysis, which is a fancy way of saying breaking down a task or a chore into smaller steps. So if you think about brushing your teeth, right, there are a lot of steps that go into brushing our teeth, and some students may require those steps to be broken down, have visual supports, maybe some examples or modeling for them so that they can access that information. So this chart that you're seeing, this page as well as our next one, are just those kind of top four if you're dealing with instant gratification. So the idea of, I want it now. I need it now. I finished that. I need you to give me a hug now. How can you support them with that management, particularly if you're a parent who has multiple children, right? Maybe you can't give that instant gratification. So those evidence-based practices, such as self-management, there's supports for that. Or again, that differential reinforcement, fancy way for how can I choose different rewards, different ways to acknowledge my child for making right choices, right? And again, that the one of the biggest things that I love is that these evidence-based practices give you prowess as parents to really develop a language as one of the most important IEP team members. I know we've kind of glanced over you have an IEP, but as a family member and a parent, you are one of the most essential IEP members. And when you go through these different modules, it also provides you with vocabulary, right? And insight around some of this terminology that we use at these meetings that can go over your head or kind of feel like, that's a whole lot of nothing. It gives you a little bit of better prowess of how to engage and feel confident in, I understand what we're talking about here. And I can also see how what's happening in the classroom around these evidence-based practices or what's happening on campus can also be utilized within the home. So hopefully this chart, as well as going back to that affirm link that Monica spoke about, and really just getting yourself familiar with those resources will help you as you move forward to supporting your child. And we also have one more slide that I know Monica will go over that kind of gives you direct links that you can look at as well.
So what I did was compile maybe my 5 favorite tools to use at home and just free links. And what I'm going to do in the chat is also just give you the link to this folder, this Google Drive that we created, and what those 5 tools are. And there's also a QR code if you want to just follow along currently. And so these 5 tools that I feel could be really useful to our families at home. I know I use some of these in my own home, and it tends to really support my kids in becoming independent and navigating through the day. So the first one is visual schedules. And so these things might help you with morning routine, structuring the morning routine, afternoon routine, and evening routine. And so within that, I have a folder that has some examples. So if you go to the website and click on the visual schedules, you'll see some different examples of free visual schedules that you can print out and use and tailor if you'd like. The next thing that I think is a really great support is the use of timers. And timers can look a variety of different ways. But usually timers help our kids know when a transition is about to happen, right? And so usually what we'll do with timers is we'll prime our students or we'll prime our children and saying, okay, in 5 minutes, we're going to be transitioning to something else, right? We're going to have to stop playing and we're going to have to get ready to go to grandma's house or whatever, right? And so we prime our kids, we give them that little bit of a verbal warning, right? We might use a visual to warn them too. And then we'll use that sand timer or like a digital countdown or even using a timer on the phone to help support that transition. I know with my kids, when they love that iPad time, I always have to set the timer on the iPad, and they know that when that timer, I'll say, okay, you have 5 minutes left, I'll set the timer, and that helps them know that this time is limited and we're going to have to move on to something else. Of course, we're going to use some other strategies like reinforcement to support this transitioning from one period of time to another. But a lot of times these evidence-based practices are used in conjunction for one another. But if you wanted to learn about the different evidence-based practices, I would take a look at visual supports and antecedent-based interventions. Again, those are within those free modules on the Affirm website. The next thing is using token boards, and there's lots of different types of token boards that you might use at home. A very simple one is first then. So a lot of times our kids have a hard time transitioning from a very highly motivating task to something less motivating, or we have a hard time getting our kids, to do something maybe that they're not as interested in doing. But sometimes if we let them know what's going to follow, they're more likely to do the less desirable tasks. So those first then boards, which I don't know if we can click on, Diane, if you can click on any of the links there, that might help.
Which one do you want me on this?
Just the first then.
Can you see that?
Yeah, and so there's Ocali. These are a whole bunch of free websites, free resources for first then boards and examples. Again, it's all free. There's also different videos on how to make them. I would, if you have some time, I would suggest taking a look and seeing these different resources. And then if we go back to the slide.
Sorry. Now I'm wondering how to get back.
A minute. Click on the other. So if you share screen again.
Yeah. Give me 1 second. I have to get back to.
So token boards are just a visual way of having our kids be more motivated to complete tasks, right? And seeing it in a visual way. I've used some token boards with my daughter, who I don't know if anybody else has the same issues, but has a hard time brushing her teeth consistently in the mornings and in the evenings, and it seems to be a chore. And so what I did was I found a token board with, and I have the example in the in one of the example in the folders of something that I used with my own kids, where it has 7 teeth for the morning and 7 teeth for the afternoon. And every day that she brushes her teeth in the morning, she'll color in one of the teeth for the morning, and at the end of the week, if she did 7 days of the morning and the evening of brushing her teeth, she'll turn it in, and we'll get to watch a TV show of her choice with her sisters, which is very highly motivating to her. There's this right here, Diana's showing us some examples of other token boards. And so if we take a look at one of the token boards, let's say if you scroll up a little bit, there's a basic 5 token board there, where you would write the child's name on, where it says blanks token board, and you would say, okay, we need to complete 5 of your chores, and what are you going to work for? And so the child will talk with you about what they're working for, and they'll decide, okay, mom, dad, grandma, I want 10 minutes of Minecraft time, or I want 10 minutes of whatever, right? And they'll indicate what they're working for. And then, you'll divide that, you'll make sure that they have those 5 tasks. When they're done with all 5 of those tasks and they cross out each one of those boxes, or if they put a little penny in each one of those 5 boxes, then they get their reinforcer. So it kind of makes it visual what they're working for, and it can be a very powerful tool. All right. So there's other examples, and again, in that more examples file, I have the one that I've used with my child. I don't know if if anyone else struggles with their kids brushing their teeth. It seems, I don't want to use the adage of pulling teeth, but it could result in pulling of teeth. But there's other resources in there that I encourage you to print out and use. And again, if you have a laminator, I purchased a laminator from Amazon for $30, and that has really worked well for the classrooms that I've worked in, and also in my own home. So again, all these resources we've provided for you in the little folders. Video modeling modeling is also really, really powerful. And so I don't know about you guys, but I sometimes when I go to IKEA and I purchase something, I have the step-by-step instructions, and those step-by-step instructions that are printed out just don't make any sense to me. And I'll go to YouTube and I'll say how to build this, whatever model of a table, and I'll watch the video tutorial because that makes so much more sense. I think that is true for everyone. A lot of times we just need to see a video of how things work and how we need to do things. And I think even with our kids, they're very motivated by visual things. They like, to watch their videos, right? And so there's a lot of video modeling platforms out there. I was able to find a YouTube Model Me Kids that had a lot of free video modeling examples. And then also there's another one from University of Indiana that had a bunch of how to make a video model. And again, on the Affirm module, there's step-by-step instructions on how to even make one, because you can simply make one yourself too by, let's say you want to teach your child how to wash their hands, and you can just video them washing hands, going through all the steps, and then hopefully they'll watch it a few times on their own and be able to get that skill on their own. But again, if you click on the link, I've provided you with a bunch of different resources. And then the last thing is visual supports. Again, there's a lot that encompasses visual supports, but we want to help our students communicate and our kids communicate, right? And so using visuals to communicate can really help for some of our kids that are struggling with language. And so I've provided 2 different links. There's some free pictures for the home, and then more visual supports for communication and routine. So, we wanted to compile some different resources that might be good and easy for you to use at home. And I hope, again, I sent you the tiny URL, but again, once you get the presentation too, you'll have links to the resources.
All right, well, we've come to the conclusion of our presentation. We really appreciate you guys being here. We're still going to go over a couple of things. We want to share some upcoming events, but I did want to make sure you guys will get all our contact information, but this is our contact. When you receive the slides, you'll have this. Here's the Antelope Valley SELPA phone number and email, Family Focus Resource Center. Please visit our website, and that's our main number. I'm at the CSUN office. We do have 3 other offices located in the lobbies of the North LA Regional Center. We've got our friends from North LA County Regional Center. Here's their main website address as well as their main phone number. And we've got Santa Clarita Valley SELPA with their website address and their phone number. So please feel free to reach out to anyone on our panel today and contact them with any additional questions. Let me share, before we start our question and answer period, let me go ahead and share some upcoming events. Malika, do you want to go ahead and share this?
Yeah, no problem. So for those of you who are a part of the Santa Clarita Valley SELPA, so that would be your child is in attendance at school districts within Castaic, Saugus, Newhall, William S. Hart, or Sulphur Springs, we have a ongoing Community Advisory Committee, CAC meeting, and our next meeting will be May 12th. We really want to encourage our families to attend. At these meetings, we talk about different initiatives that are happening within our area. You have an opportunity to hear from our directors, and they talk about different programming and what that looks like at each district. And then following each of our CAC meetings, we also have parent workshops. The next parent workshop will actually have guests from Family Focus Resource Center, as well as our North Los Angeles Regional Center, who will talk about resources that you can use particularly for the summer, but at home, out in the community, because that's been a big request for families. So please tune in. Please come next year. We really appreciate family feedback, and we want to make sure that we're creating workshops specifically that meet your needs. So having you in attendance helps us and helps guide our focus.
Well, thank you.
Mhm.
Monica?
Yes, and so we also have a community advisory committee in the Antelope Valley, and we have, again, we have events all year long, and we have our next meeting. We had one yesterday, but we have our next meeting. We'll have an hour presentation on behavior boot camp, so preparing parents for the summer stretch. And that will be on May 13th at the Antelope Valley SELPA and on Zoom. And here's the link to the Zoom if you'd like to join us. We, again, on our Antelope Valley SELPA website, we have all the flyers for upcoming events. But one of the things that we also are really hoping to get is if you are a parent in the Antelope Valley, we have surveys that we send out to all of our families within the month of May, prior to coming up with our calendar for the following year, and our board, right, likes to really find out about what is it that our families want as far as topics for workshops, etc. And so I have these two, I'm going to put these in the chat. If you would be able to fill out if you are living in the Antelope Valley and would like to share what you might like to see, I'm going to put these two in the chat. And if you wouldn't mind taking a minute to complete this, I'll put it in English and in Spanish in the chat. Again, yeah, we have meetings throughout the year. We have representatives from all 10 of our districts that come and help provide support to families and information about really how to navigate through the special education system within the Antelope Valley here. So.
And Monica, we can include those surveys also. If they can't get to it right now in the chat, we will include that in the email that we send to everybody at the conclusion of the workshop.
Wonderful. Oh, and I see somebody right before and after I put in so the reason why there's no LAUSD or Long Beach here is, again, our group, our region for Captain. So Captain is set up all throughout the state of California, but the region that we are here representing is specifically for the Antelope Valley and Santa Clarita Valley SELPA areas. And so what we can do is if you wanted to go onto the Captain website, you can find out what your Captain team is doing in that area if you're part of LAUSD, and LAUSD is huge. So I think there is there is actually one Captain area for LAUSD, but I can put the link to the Captain website on there, and you can see the website for your own Captain team in that specific area. Yes, there's a Captain team for Long Beach and Los Angeles, and there is a SELPA. SELPAs are throughout the whole entire state of California. So there is a SELPA for LAUSD and a SELPA for Long Beach. But I will put the link for the Captain website in the chat.
And also, yeah, we will also include that in the email that we send to you, so you can look for your own Captain group in your area. Family Focus has some workshops still coming up on generic services. These are all virtual, presented by Disability Rights California. One of their senior attorneys. We just had SSI eligibility and appeals, and that workshop was recorded as well and is up on our YouTube channel. But next month we will be having a 2-part series on Medi-Cal basics and Medi-Cal waivers, and then finishing up in June with our IHSS series on IHSS basics, IHSS assessment and reassessment, and IHSS appeals. So those are given in English and Spanish on different days. So please make sure to join if you would have interest in those topics. We monthly do an IEP Essentials workshop in English and Spanish. English, we do them once a month. English on Wednesdays and Spanish on Thursdays. The next upcoming IEP Essentials workshop will be on May 14th and May 15th. So you will have access to these flyers when we send you this PowerPoint. Oh, shoot. We did, because I can't refresh. We do have a workshop coming up. We did put in a flyer, but it didn't update this presentation. But we have another Captain presentation coming up next month that we'd like to invite you guys to, which is going to be May 15th from 11 to 12. And it's called Picturing Success, using visual supports to enhance learning in children. So you will be getting that flyer also in that in that email that we sent to you. So I'm going to go ahead and stop recording now.